might ask, what would contraindicate this adjustment? And one thing that would contraindicate this adjustment would be if he had anterior instability. And so he's fixated in horizontal abduction. You want to contact the clavicle just lateral to the joint, the superior hand, and the superior to inferior, medial to lateral tissue pull using my hypothenar eminence, not my pisiform. He takes a deep breath in and holds. I stabilize my hand, and I'm going to stress and thrust from superior inferior into posterior medial lateral, avoiding too much A to P force. Questions? Same exact adjustment. You can bring your arm up if you if he's fixated in horizontal deduction, right? Horizontal deduction, that's right. Same exact contact here, but now we're going to bring the arm into this position, let the elbow bend, have him completely relax. And when he takes his breath in and holds, now I'm going to protract, stress, and thrust. So those are the first two adjustments. Are there any questions? Now I'm going to ask you to sit up for me, please. The third adjustment for the sternoclavicular joint we did in a seated position. And by the way, if it's a woman for that, you should ask the woman to cover the breast with the other hand, and be sure to do that each time that you're working with a woman for every adjustment for which that's appropriate. And would you mind taking your shirt off for this, just so people can kind of see what that is? Very professional class. Now, of course, this is a higher table, and you need to do it properly for the table there. And you have the entire room. You can pick any table in the room. You can set the height of the table any way that you want. That's up to you. The entire room is like your clinic. But remember, when you do it, you want to have it in a proper position. And so first of all, I'm going to ask you to scoot back from me just a little bit. So I want them right at the edge of the table so I don't have to lean over. And then I'm going to take my mid-axillary line and place it on his spine. So I have a scissor stance to hold that position properly so I'm not leaning forward. And then I'm going to contact the clavicle. So here is the sternoclavicular joint. I come a little bit lateral, so I'm not right on the joint. I'm lateral on the joint. Careful not to push the necklace chain into his skin. And then I take a hypothenar eminence contact with the superior and inferior medial lateral tissue pull. I'm going to have him relax. And I'm going to take the bend in my elbow, the little V that I formed by bending my elbow so I can retract him. And I ask him to take a deep breath in and hold, and just lean back against me as I bring him up into abduction, external rotation, and I stress and thrust with both hands. So I'm pushing and pulling the clavicle laterally and inferiorly. So Sam to Bill. Any questions? Let's do just a couple more and then we'll go to the next individual. Okay, let's have you lying back once more. Acromioclavicular joint. So for a superior clavicle, these are the most common ones. I want to try to stabilize the scapula as best I can. And so I start that process by having him slip his hands under the thighs and then lock his elbows straight. That's good. And so now when I push on the clavicle, the arm as well as the weight of the body pushing the scapula into the table will have to stabilize the scapula as I'm going to stress and thrust on the clavicle. And so, slide you over again. Let's give you a little better view, okay? And so there's two ways of doing that. So first I can pull. So from this position, I find the acromioclavicular joint. I come a little bit medial. I place 3 fingers on the clavicle. I cover it with another 3 fingers, and I simply stress and thrust from S to I. Or, coming from a superior position, take a thumb contact. So my thumb is going to be in this position, so it's vertical to the table, right? And so I take a P to A tissue pull, right at the lateral aspect of the clavicle, the flat part of the clavicle, and I cover it with my pisiform. And again, stress and thrust from S to I. Those are simple kind of procedures. Now I'm going to ask you to sit up. And you can use chairs, by the way, or the lower tables for this, but this table is way too high for this. So now, this is actually my favorite adjustment for the superior clavicle. It's a seated position. And so now I've got to be careful about what I'm going to do and how I'm going to do it. So here again is the joint. Remember, you should be able to find that joint very carefully. Elevate, depress, retract, and protract is part of finding the joint. So again, I want to contact the bone, not the joint. So I'm coming a little bit medial in that process. And I'm going to use a hypothenar contact, stressing from lateral to medial in this process. And so I'm coming from here, I'm going to relax the arm, have them in a 90-degree abducted position using a hypothenar contact on the lateral aspect. Now, I'm going to stabilize by pre-stressing by pulling laterally on the humerus at the same time that I push medially on the clavicle. When I do both at the same time, I distract the joint. And then notice my positioning. I'm positioned so that my forearm is vertical. And now I can stress and thrust directly S to I, or maybe even a little bit lateral to medial as well as S to I, just like that. You with me on this? Okay. I do not position, this is the biggest mistake. Getting like this, you don't have any control in this position. You need to stay way lateral to have control in this position. Thank you very much. Good, put your shirt on, I'll pick someone else out. Any questions?